Good afternoon, everybody, and thank you again for helping us get our message out. I'll start with a few numbers, and then we'll have a brief update, and then we'll get to questions. So some good news. As of this morning, we have a total of only 16 inpatients across our system. One of them is at A.R. Gould Hospital, 12 at Eastern Maine Medical Center, one at Maine Coast Hospital, one at Mayo Hospital, and one at Mercy Hospital. We also are taking care of 12 individuals who are positive with COVID-19 at home through our home care and hospice service. And so great news to see those numbers coming down. But I always put in that the word of caution. It takes only one small outbreak to spread across the state. So remind people to please be diligent, wear their face coverings, remain socially distanced, don't gather outside their household, and wash your hands. As far as vaccine numbers go, as of Tuesday morning, we had administered a total of 29,118 doses of vaccine. That represents 21,183 first doses and 7,935 second doses. We continue to successfully operate vaccination sites in several communities in Maine, including our mass vaccination site at the Cross Insurance Center in Bangor. As you may know, the director of the Maine CDC, Dr. Nirav Shah, visited the site on Saturday and provided very positive feedback on the efficiency in which we were able to move patients in and out. But we've heard similar comments at our site up at A.R. Gould, our site at Mayo, and other sites across the state. So we're very proud of what we've been able to do. We do have video available of that visit if anyone is interested, and we can provide you with a link and access if you would like. I'd also like to inform you that beginning Saturday, we will be opening up a second vaccination pod at the Cross Insurance Center that will allow us to add 20 more tables and 30 more staff, which will increase our capacity to up to 3,000 vaccinations per day. Ultimately, volume will depend on vaccine allocation. As a reminder that moving forward, all of the Bangor area vaccination events will be at the Cross Insurance Center. So even if you received your first dose at Eastern Maine Medical Center, your second dose will be administered at the Cross Insurance Center. Let me provide a few helpful hints for people who are visiting any one of our vaccination sites. Please arrive a few minutes before your appointment, but know there is no benefit to being there more than 10 or 15 minutes early. We have enough vaccine for everyone who has made an appointment. Have your confirmation number available if at all possible, but if you don't worry, we will help you. Please, no food or drink in any of our vaccination sites. You can expect to spend at least 15 minutes in the observation area after receiving your vaccine. A limited number of people may be asked to stay in the observation area for 30 minutes or more, depending on medical conditions. Here's a few additional tips specifically for the Cross Insurance Center vaccination site. If you have an appointment to get your vaccine at the Cross Insurance Center, visit northernlighthealth.org and click the COVID-19 vaccine link for a brief, helpful video about what to expect. It's only a couple of minutes long, and it will show you everything you need to know about the vaccine site and the vaccination process. We also ask that people tune their radio to 88.1 FM when they arrive to find out what appointment times we're currently serving. Stay in your vehicle until your appointment time is called, and then come into the building for the fastest, most convenient service. Quick update on registration. Per Maine CDC guidelines, we are vaccinating people age 70 and older in addition to healthcare workers. Community members over the age of 70 can currently register online at northernlighthealth.org or through our call center hotline 207-204-8551. We ask that you dial carefully as to avoid calling someone who has a similar number, and yes, that has happened. New appointments are added on Monday at 2 p.m. As a change going forward, if additional doses become available after that time, we will be adding them to the online registration site on Wednesdays at 2 p.m. So just an hour from now, we will do that for the first time. We expect this will be a very small number of appointments, and so we will not be offering via the call center at this time. The call center is a new feature for our system, and we are working to establish a contact with a call center provider to help expand capacity and support our staff working on the phone line. The demand for the vaccine continues to exceed our supply. We appreciate your patience. We're getting people vaccinated quickly after we receive the vaccine, but supply remains very limited. People have come to our vaccination sites to ask if there are any leftover vaccine and if they can get vaccinated without an appointment. Unfortunately, we cannot vaccinate you without an appointment, and I will say that we are a model of efficiency at these sites, so we do not have vaccine left over after vaccinating those who have appointments. We also have been asked by many people if they can stop wearing masks after they have been vaccinated and stop following the strict safety guidance. The answer to that is no. Your body takes days to even weeks to build full immunity after being vaccinated. And even though both Pfizer and Moderna vaccine are highly effective, they will not work for a small percentage of people. Beating the pandemic requires several important measures, and vaccination is just one of them. We all need to continue to take precautions to prevent the spread of the disease, even if we've been vaccinated. And I'll turn it over to Paul for a few comments.
Thanks, Dr. Jarvis. Just want to make sure that we're giving credit where credit is due. Our staff have been tremendous throughout this vaccination effort in particular, and we couldn't have done it or couldn't continue to do it without the hundreds, if not thousands, of staff who are working to make this all possible. As Dr. Jarvis mentioned, every shift at the Cross Center has 100 staff and volunteers working, soon to be 130. That's a significant effort that requires dedication to folks from all areas of the healthcare system, and that's just the Cross Insurance Center, not to mention our other vaccination sites throughout the state. So a tremendous effort, very proud of our team. And we're honored to have the vaccine and the privilege to vaccinate our communities.
Thank you, Paul. And with that, we'll open it up for questions.
Thanks, Dr. Jarvis. Thanks, Paul. Kicking off questions today will be Ann, Ellsworth American. You should be able to unmute now, Ann. Go ahead.
Thank you. I have a question about how Northern Light is prioritizing staff vaccinations. I learned recently from a trusted source that 2 Northern Light staff members received a first dose on January 4th. They were both in their 30s. One was in IT and the other was an analyst. And I'm asking this because I'm receiving so many emails, although not as many as 2 weeks ago, from readers who have not been able to get an appointment and are in their 80s or 90s.
I think I'll let Paul address that, and then I'll have comments afterwards if needed.
Sure. So you're asking some specific questions about particular employees, and I'm certainly not able to comment about individuals and their health care from a privacy standpoint. But generally speaking, your question was 2 information systems employees, apparently, according to what your source is saying, were vaccinated. I don't doubt that that's accurate, in that we have our information system staff providing at-the-elbow support, technical support in the field, in our hospitals, and many other areas that are patient-facing in patient care areas and supporting our direct care workers. So that doesn't particularly surprise me that may have happened. Our focus has always been on vaccinating employees who are most at risk and at the front lines of COVID. And as we have risk stratified, we still have the majority of our administrative staff, about 1,400 people, working remotely, have not yet been offered vaccine and will not be until the Maine CDC says it's appropriate to do so.
Yeah, I don't have any further comments on that. I think some people get tripped up by what we mean by forward-facing or patient-facing, and we're not just talking doctors and nurses here. There are many parts of a hospital and a healthcare system where people interact with the public and the patients on a regular basis, and it is urgent that we protect them as much as we protect our doctors and nurses. So thank you for the question.
Thank you.
Did you have a follow-up, Ann, or no?
Oh, no, I'm set. Thank you.
Great, thank you.
Good afternoon. This is Bob Evans. On the tails of that question, what procedures are in place at Northern Light Health facilities to avoid people and employees jumping the line and getting vaccinated early, like has happened at other healthcare systems recently after vaccinating employees who are not in direct patient contact?
Thanks, Bob. So I'm not going to talk about any other health system because we can only speak for our own. From the beginning, as far as it goes for employees and healthcare workers, we have followed the guidance that the Maine CDC has put forth for us, and we've been very strict about that. Our employees must sign up for an appointment to get vaccinated, just like anybody else in the general population. It's just through a different process because they are employees or providers who work within our installation. For the general population, our website is designed to identify individuals who are over the age of 70 when they are going through the registration process. We do ask that on site people do bring some form of verification that they are indeed a resident of the state of Maine. And if they have proof of age, that's also helpful to us. I will say that as a person who has been at almost all of Eastern Maine Medical Centers and now the Cross Insurance Centers, general population vaccination sites, we have not seen any of the issues that we have heard out, particularly in other states. People genuinely are being honest and forthright with us, though we do have some procedures and policies in place that would be able to determine if fraud had occurred, and we hope to limit that as much as possible. At the same time, we're not police, and we're not in the business of policing healthcare, and we are trying to do the best we can in that situation. There's always that possibility that someone falls through the cracks and makes their way all the way through, but I think with our process right now, we have not really seen that to any great length at all.
Understood. Do you feel the state has been clear with its guidelines to healthcare facilities, even though some changes have been made along the way as they figure this all out on who should be getting the vaccines first?
In my opinion, yes, indeed, the state has been very clear in their directives. As a state, we do meet together with the large health organizations, including people from the state CDC and from the Department of Health and Human Services. I believe, from my opinion, their guidance has been direct to us, and the guidance for the general population has been direct. Currently, we are only vaccinating those over the age of 70, healthcare workers, first responders, and a few select essential workers.
Thanks, Bob, for your questions. Up next, we have David Horowitz, Channel 7. David's having some audio issues, so he texted me his questions to ask. This one is for you, Dr. Jarvis. Why is it important to wear a mask after you've been vaccinated?
So that's an excellent question. So nothing is 100% and no vaccine is 100%. While we're delighted from the results that we're seeing from both Moderna and Pfizer in terms of both protection and limiting severe and moderate disease, it is still possible that somebody could become infected after being vaccinated. We also know that vaccines do not work overnight. It may take days to weeks before somebody reaches the immunity level that's needed to help prevent contracting the disease or spreading the disease. So because of that, we still need people to take precautions. If we look around the country, we're barely at 10% of the population having been offered the vaccine, let alone receiving a vaccine or their second dose. And while Maine leads the way in this endeavor, we are still far from that critical point of somewhere between 70 and 80% of the population being vaccinated to have enough immunity that we can drive the amount of virus in our communities down low enough to get back to some semblance of normalcy. So yes, while being vaccinated provides you some protection, and hopefully protection at least against getting severe disease or hospitalization or worse, death, we do know that people can still contract the disease and spread the disease even after being vaccinated. So we all still need to take those precautions until we get enough of the population vaccinated to feel that the immunity level and the virus level are at appropriate numbers. So thank you for that.
And for David's second question, he asks, do you anticipate that next year at this time, masks, social distancing, etc., will continue to be the new normal?
So I always get those crystal ball questions. And while I think we've done a pretty good job predicting things, I can't foresee that far into the future. I have said that multiple times that at least through calendar year 2021, we will continue to mask and have limited gatherings across our state in order to protect the populace. It really is going to depend on how many people actually get vaccinated, in what time frame, and then what that long-term immunity with that vaccine what results from that. So if it turns out that we need to get vaccinated each fall, which is what some people are predicting, then it will be a little bit longer that we'll be wearing masks, because we'll just have to worry about that when the fall comes.
Okay, next up we have WABI. Owen, you should be able to unmute now. Go ahead.
Thank you very much. And thank you, Dr. Jarvis, for taking our questions today. First of all, we've received calls from some of our viewers that folks are getting billed for long distance charges by calling your number to set up a vaccine appointment. I want to know, is this something you guys are aware of and trying to work on?
So we were made aware of that today. We are looking into it. Unfortunately, there are numerous different calling plans across the state of Maine, and while this is a local state of Maine number, for some people it may fall out of what's considered their local area, and we don't have any control over that. That's a billing issue for the call plan that some individuals are on, but we are looking into ways that we can mitigate that. So thank you for bringing that to our attention.
And Owen, did you have a follow-up?
Yes, I did. Sorry, I think I accidentally muted myself again. What I was going to ask as a follow-up is you mentioned that there are 16 inpatients in the Northern Light system right now who are being treated for COVID-19. With all the numbers that we're keeping track of day to day, week to week, this hasn't been one of them. But can you explain maybe some of the context behind this? What has that number been trending even the last few weeks, the last few months? And what is the significance of being able to get that down to 16?
So if you remember, after Thanksgiving holiday, Eastern Maine Medical Center alone had 55 patients positive for COVID-19, many of whom were in that seriously or critically ill category. So it's a wonderful news for us that we've seen that trend come down off of that, particularly in the last few weeks. Eastern Maine Medical Center is at its lowest point as far as our surge planning goes since the pandemic began, and that's wonderful news as well. And so we like to see that continue. It is good news across the state that hospitalizations for COVID has gone down, but we are still quite a bit of ways away from being where we were just at the end of the summer. If you remember, we used to talk about that crossing that 1% positivity threshold for testing was an indicator that things were headed in the wrong direction, and we are still not below that 1%. As a state, I believe we're somewhere between 2 and 3%, and various places around the state are as high as 6% positivity rate for testing. So there are still pockets of disease out there. We need to, while this is good news for us, and we need to celebrate that good news, we still need to remain diligent in taking care of ourselves.
Thank you for your questions, Owen. Now we'll turn to WMTW, Allison. You should be able to unmute now.
Hi, thank you so much. Yes, just one quick question here. So you say that people, they can't wait around at the end of the day just to hope to get a shot. But what if someone doesn't show up to their appointment and you do have leftover shots? Then what are you doing with that those vaccines?
So that's a great question, Allison. It really has to do with the way our process is. So while as the day begins for any one of our clinics, we do start drawing up syringes of vaccine. As we get close to the end of the day, we actually get so precise that we only draw up a syringe as someone enters into our facility. A great example was yesterday. We got to the point towards the end of the clinic at the Cross Insurance Center where we were counting people as they walked through the door and drew up out of the vials each individual syringe, ending the day with only one syringe left over. And then we were able to identify an individual who met the category for vaccination and give that. But we are so precise because we do not want to waste a single dose of vaccine, that we can pinpoint pretty accurately what we're going to need at any given time during a vaccine clinic. And so that's the reason why there isn't vaccine lying around at the end of the day, because we use it all appropriately.
Great, thank you.
Allison, did you have a follow-up?
Nope, that's all. Thank you.
Thanks, Allison.
Great. Next up is Charlie, Maine Public. Hold on just a second, Charlie. Okay, you should be good.
Great, thanks, Dr. Jarvis and Paul. Appreciate it as always. My first question is about the various variants and mutations of coronavirus that we're hearing a lot about elsewhere in the country and the world. I guess it's a two-part question. The first is whether Northern Light is doing anything specific to map out the cases it's seeing, to just determine whether any of them are mutations, and then more generally, are the cases of coronavirus you're seeing behaving in ways that make you think they could be a significant mutation?
So those are two very good questions. Somebody needs to go on mute. So the first question was, is Northern Light Health doing anything to look at the genome of to see if we have any variants here in the state off of coronavirus? And the answer is yes. We are part of the state's project in looking at doing genomic testing. And so we have a randomized process where we send samples to the state for genomic testing to be done to see if we have any variants. In addition to that, our lab is working with some resource labs that do those kind of testing in order for us to map out if we saw or suspected that maybe a variant has occurred. And so those are two parallel processes that are going on. Right now, it looks like Maine has been somewhat protected from this, and much like we found in the very beginning of the pandemic, things come to Maine later than they come to the rest of the world, and that's just due to geography and travel. So right now we are lucky. Right now I do not see any indication that we have seen specifically the UK variant, the one that is more, is more infectious but not any more virulent. So we have not seen any of that spread, and that really follows along the fact that we've been seeing the numbers of positive cases and hospitalizations decline. But that does not mean that it would not take just one event to start a super spreader event for us here. We do know that there are variants in states that are adjacent to Maine as well as across the Canadian border, and so it's something that we need to pay attention to, and it's certainly something that's a concern for those of us that work with population health.
Great. Oh, yeah, just one second quick question. I think I asked this a couple weeks ago, but I'm wondering if there's an update. Maybe, I guess Paul could probably answer this. The uptake of vaccines among Northern Light staff. Do you have the latest for that?
Sure. At this point, in terms of the percentage of Northern Light employees who've declined, we're still around the 15% mark, just shy of that. We do have employees coming forth every day saying, now that I've thought about it, now that I've seen my coworkers become vaccinated, I'm interested now in becoming vaccinated. So we are seeing that number diminish. We're continuing to do education among our employees, but we're pleased that the decline rate of our employees is about half that of what we're seeing nationally.
All right, thanks, Charlie. Next up, we have Dustin. NBC Boston, NECN. You should be able to unmute now, Dustin. Go ahead.
Let's be honest, this is similar to a question that was already asked. The vaccination of non-patient facing employees, did that occur at Northern Light Health? How, and if so, when, why, and how many employees?
So we don't have a number of non-patient facing employees. And let me first preface by what a non-patient facing employee might be. The employees that we have who are not working in a healthcare setting are not being offered vaccine. We do have a number of employees who are working in jobs that are different than their normal position, such as at the Cross Insurance Center, where we have 100 or so employees, 20 of whom are vaccinating, 80 of whom are performing work such as helping patients ambulate, helping push wheelchairs, helping people sign in. Most of those employees and volunteers are people who would be doing work other than a patient-facing role. And so throughout, Northern Light has adhered to the Maine CDC's guidelines in terms of how vaccines should be administered. And as the state modified or made more clear their expectations, we certainly made adjustments as well. And so what we've seen from an infection rate among our employees is that the vast majority of employees who became ill with COVID from any work-related exposure did so from their colleagues, coworkers that they share a break room with, et cetera. And so it's very important to understand the importance of having a vaccinated workforce. And so I think that's a very germane piece to consider when asking questions about patient-facing and non-patient-facing colleagues, because colleague safety is very critical to our ability to continue to care for the community, such as in ways that are outside the norm, such as the vaccination clinics, COVID testing sites, as well as our normal patient care activities.
Has anyone from out of state gotten a vaccine from Northern Light Health? And, are you relying on any out of state contractors for anything? Because I know that there's other groups around the country who've had to bring in people like nurses from other spots to help out. So is
Sure.
anything like that occurring?
Sure. So we have had some small number of locum physicians who come for 3 to 6 month assignments typically, who would have been offered vaccine appropriately as healthcare workers as part of our workforce. We also would have nurses. We have a cohort of close to 100 international nurses who are here for 2 years and work with us as part of our nursing workforce. So those are not employed, but they are contractors, and they would have been offered vaccine appropriately as well.
Okay, thank you, Dustin. Next up, we have David Marino, Bangor Daily News. You should be able to unmute now, David.
Thank you. This question is directed at Paul. You answered this a little bit earlier about the number of, Northern Light Health staff members who have declined to be vaccinated. But what I would like to know is if at any point, are they going to be compelled to be vaccinated if they're going to be working with patients? What is Northern Light Health's policy towards that vaccines in that regard?
So currently under the emergency use authorization, the vaccines are not something that the government is mandating. Northern Light Health has no plans at this time to mandate vaccination to our employees. We think a better approach is what we're doing right now, which is educating people on why it's important and making the vaccine available as soon as we're able to do that for all groups based on the CDC's guidelines. So we don't have plans to mandate that, and we'll certainly see if the state or federal government change their approach to that.
Great. And my follow-up is for Dr. Jarvis. It was announced yesterday that 24 Walmart and Sam's Club locations across Maine will begin offering about 4,600 vaccines per week to residents as part of the federal government's retail pharmacy program. Do you believe this increased vaccine access could make it unnecessary to expand the cross center to eventually be vaccinating what you said you want to do 5,000 people a day possibly? Do you think that could make it unnecessary possibly, like potentially?
So David, great question. Dan, we welcome any additional vaccine into our state. Let me be clear about that. The more people we vaccinate, the faster we vaccinate them, the better it is for our communities. But the reality is, at some point, we will be giving both first and second doses in the same clinic out of the Cross Insurance Center. So yes, we will continue to need to have a high capacity, high throughput location for that to occur. A good thing to remember is that even if the state of Maine were vaccinating 10,000 people a day, it will take 100 days to vaccinate 1 million people once. And most people will need to be vaccinated twice. And so with that said, we need to have that capacity to be able to do that. And in our large urban centers, particularly in the Portland market and the Bangor market, we will need to have those kind of facilities that can generate that large volume. At the same time, we welcome all of our small clinics that are going on. We welcome the federally qualified health centers and the smaller hospitals that are doing their share to get people vaccinated. And this is just another addition to that so we can get as many people vaccinated in as short amount of time as possible.
Okay, last but certainly not least for today, we have Joe Lawler, Portland Press Herald.
Yes, hi, thanks for taking our questions. Along the same lines about the Cross Insurance Center, let's say we do get to, like right now, I think we're at about 22,000 vaccines coming into the state per week. I think next week it's going to increase a little bit according to the White House. But let's say we get to 40 to 50,000 vaccines per week. I know you said what your capacity is, 3,000 per day, but at that point, I'm just trying to get a sense of, like, when the supply increases, what does that mean for your average daily throughput at the center? I don't know if my question made any sense, but
it did. So I can talk about the Cross Insurance Center, both on our vaccine clinic on Saturday and then again on Tuesday. We got to a point where we were vaccinating 200 people an hour. We can maintain that for a 12-hour shift without any difficulty with the setup that we currently have. As I said before, this coming Saturday we'll actually open up our second vaccination pod, which will make it even that much easier for us to maintain a pace of 200 to 400 vaccinations per hour. For us, there's two limiting factors to that. vaccine and staff. And as Paul said, we have been blessed with people who want to both volunteer and work at these vaccination sites. It's incredibly rewarding. I can tell you countless stories just from yesterday's clinic alone of individuals who are over the age of 90 and several who are over the age of 100, where this is their first time out of their house since March. And they were delighted to be there. Overwhelming joy to be able to now feel a little bit more safe in their own homes, and then hopefully to be able to venture out more. And so when you're a worker out there, you feel that energy, and it's just been an incredibly uplifting and positive experience for all of us. As healthcare workers, it has not been an easy year for us. We have been challenged in many, many, many ways, not the least of which is seeing our patients die right in front of us. To now be giving people hope is a positive thing. And so I do not think staffing is going to be our limiting factor. It's going to be vaccine doses. And when we get them, we will use them.
Okay, that was great. Thank you. I guess I was wondering, just kind of in the more short term, let's say the state gets to, say, 40,000 doses a week, roughly double what we're doing now. I know your capacity is great, but realistically, from the supplies that you're getting, or you would get if you got double what you get now, how many people would you be vaccinating per week at the Cross Insurance Center?
It is our endeavor to get to a point where we can vaccinate 5,000 people a day, 6 days a week. That's where we would like to be.
Okay, well, that's our final question for today, and we'll get things wrapped up. If you'd like to receive a high-quality video file of today's conference and you haven't let us know in the chat, please shoot us a message before you leave. Thanks all for being here and for helping us keep everyone informed. To wrap up, I'll turn it back over to Dr. Jarvis for the final word.
Once again, thank you all for getting our message out. It is clear people need to be patient. We will eventually get to everyone with vaccine. It's just going to take a period of time. Until that time, please stay safe.
Thank you.